What historical changes shaped LGBTQ plus STI prevention? Imagine a time when talking openly about sexual health was rare, and many LGBTQ plus people faced stigma and silence. The story of how STI prevention evolved for LGBTQ plus communities is full of resilience and innovation. Starting in the 1970s, before HIV and AIDS were known, gay and allied health professionals began creating their own guidelines for safer sex. They used simple tools like the Safe Sex Hanky to communicate and promote safer practices within their communities. These early efforts focused on harm reduction and peer-led education, which helped LGBTQ plus people learn about risks and ways to protect themselves without relying solely on mainstream health systems that often ignored their needs. In the early 1980s, the HIV/AIDS epidemic changed everything. The virus spread rapidly, and the initial government response was slow and sometimes stigmatizing. LGBTQ plus activists and organizations stepped up to fill the gaps. Groups like the Gay Men's Health Crisis, founded in 1982, and later the AIDS Coalition to Unleash Power, or ACT UP, became vital voices. They pushed for better information, access to testing, and safe spaces for treatment. These groups fought against discrimination and helped spread awareness about safer sex practices, including condom use, which became a key prevention tool. As the crisis grew, community organizations started offering testing and education programs tailored for LGBTQ plus people. They emphasized the importance of condom use and later introduced biomedical options like pre-exposure prophylaxis, or PrEP, which can prevent HIV transmission. Public health campaigns, like the U.S. Surgeon General's mailing of an AIDS information booklet in the late 1980s, marked a new era of open conversation about sex and disease. These efforts helped normalize discussions about sexual health and STI prevention. Specialized clinics also played a big role. Places like Fenway Health provided healthcare that respected LGBTQ plus identities and offered STI testing, counseling, and prevention resources. These clinics made a difference by creating safe, welcoming environments for community members seeking care. Today, biomedical tools like PrEP are widely available, but condoms remain as essential for preventing many other STIs. The history of LGBTQ plus STI prevention shows how community-led initiatives, activism, healthcare services, and public education have all worked together to improve sexual health and reduce the spread of infections. It's a story of ongoing progress built on resilience, innovation, and the power of community support.